Uh, well, I've treated over 10,000 children with Lyme, and in co-infections as well. And a good many of the children we've found have had autism spectrum disorder. And I'm going to focus a little bit on that. One, by illustration, a little boy recently came to the office, well, recently, about 2 months ago, who was 3 years old, who was cute as a button, had brown tousled hair, very bright eyes, was very active in terms of being playful and running around trying to hide from his parents and elude being caught. He came in with a history of being normal at birth, sort of. At birth, he was suffered from hypotonia, and the question was, his parents brought him in to see whether he had perhaps a tick-borne disease that was affecting his autism. On questioning the dad, he had Lyme disease, very active Lyme disease, dating back 5 years before his son's conception. And he also had, dating back 2 years before his son's conception, Babesia, not Microti, but Dunconi. It's a very difficult to treat Babesia. The mother had no history of Lyme, so she thought. But on careful questioning, she did have an increased tendency to have panic attacks that preceded her pregnancy with a little child. The panic attacks were growing more severely in intensity. She had never been worked up for Lyme or for co-infections. And when she was in the office, we do some blood on her and on her husband as well. As it turned out, the little child had one antibody that's genus species specific for the Lyme bacterium, and that's 39. The only way he could have had the 39 antibody would have been to have exposure to the Lyme bacterium at some time. They lived in a non-Lyme endemic area at that time. Both parents lived in a Lyme endemic area on Long Island most of their lives. When the child was born, they lived in a concrete facility in New York City, and without travel to Lyme endemic areas. So the probability is that the little boy did have exposure in utero and through breast milk, and not through a tick-borne organism. The child had also not just Borrelia burgdorferi, but he was DNA PCR positive for Mycoplasma fermentans. And I've found in my brief encounter of children with autism spectrum disorder that almost all of them have Mycoplasma fermentans DNA PCR positive blood tests. He was placed on antibiotics. He's actually placed on Zithromax and Bactrim. He made a very interesting response. He came in without any ability to speak. He'd gone from a 2-year-old who had 30 words and pretty normal development to a 3-month-old child who had no words. He was started on antibiotics prior to seeing me, and by a very astute pediatrician who knew about the possibility of Lyme and autism. And he was beginning to develop vocabulary again. He tried to repeat everything that we said, and his vocabulary had increased to 8 words over a period of 3 to 4 weeks. He had one factor, one manifestation that was not common to a lot of the kids with autism. He had perfect eye contact, and he never lost it. He did definitely lose his vocabulary.